The true importance is to make healthcare accessible. Many of our centers, we're located in the physical structure of public housing. Some we're located across the street, down the street. We even have mobile services. But the common thread is accessibility. But even though we're located, say, perhaps in a building or in a unit, that's not guaranteed accessibility. You still have to extend beyond those four walls of where you're practicing medicine. So I say accessibility, but I'm really not talking only about a physical structure. I'm talking about how engaged we are in the community, how that trust, how well we know what the needs are. For example, some of the senior facilities that we're located in, public housing, senior high-rises that we're in, we have to know what it is that they're facing, not necessarily what we have identified that seniors have risk factors regarding, whether it's depression, isolation, whether it's socialization, but in some way we weave that in to providing health care, to get your blood pressure checked on a regular basis, to have your medications brought in and identified so that we can see exactly what you're taking. But that doesn't just happen, and we can't hang a shingle on the door and say, you know, come and do these things. Outreach is a key component. Community health workers play a vital role in what we do. So I say accessibility is number one. But I also see why we do what we do is to bring about an awareness that exceeds beyond the health care. Often what echoes in my ears, I hear a patient that was newly had his hypertension managed. And he said, I didn't know I felt so bad until I started to feel better. So it's almost like being numb to the existence that you have until there's an unveiling or an opening of your eyes that there is something better. I can feel better. I can do. And all of that comes about by being there and taking health care to people where they're able to connect in whatever way it is that they need to connect in.